of our GDP on healthcare right now. It's expanding. A place like Canada, a place like the UK, Scandinavia, they spend in the 6 to 8% range. And by many measures, really every technical measure, have better outcome, longer lives, higher quality of life, lower infant mortality rates, et cetera, et cetera, et cetera. So what we're having doesn't work. And just personally, I think socialized medicine would be a massive step forward, but it's almost a separate question than kind of integrating within environments and providing prevention through decent education and housing, gender equity, and reducing violence, all these things that could happen, but are just not on our agenda. Where have you seen that drop off the most? I agree, it's not on our radar, and we have a great capacity for forgetting our less powerful folks and shutting away whole neighborhoods or ignoring the 45 million people who aren't insured or something. But where have you seen the biggest drop off?
Well, I just in my entire career, I started in social work, and I'm in healthcare administration now, and I'm a minister, so there's sort of like a convergence of, and in all those arenas, it's not a conversation that really happens in this country anymore. And if you use, it's just like it's so politically driven, the conversation has been, and it's so driven by business, like when we talk about outcomes here, we're really not going to talk about any outcomes until we talk about financial outcomes, and then we never get to the outcomes that you're talking about.
Yeah.
So do you have to, are we just too affluent to ever get to the root causes here?
Some of us are too affluent. Again, this can become a polemic and less precise debate, but insurance companies don't need to exist, right? They don't. It's an entire industry that doesn't, for healthcare, need to exist. If you created a system that had a single payer, that efficiency would spill over, and you could, the savings with that would be tremendous. The other hard reality is, and one of the first things that comes up in this debate is, my healthcare is probably the best in the world. I'm insured. I know a lot of doctors, and if I needed open heart surgery tonight, it would happen. That doesn't mean I'm going to be healthier. More intervention and more medicine doesn't mean you're going to be healthy. That's a whole other kind of question in public health. But I think that's a real barrier to our creating change. The fact that people in power and people who make decisions have, in many ways, the best healthcare in the world. It's hard to create change about that. One thing to watch out for. I'm new to the city, but I work at University of Chicago that doesn't have a trauma center, and I'm also surrounded by rich folks like I guess myself and certainly others like the Obamas and whatnot. If I got shot in the neighborhood, I'd be getting up Lakeshore Drive to Northwestern, and I would rather stay in the neighborhood. And so maybe there are some places of overlap, and certainly infectious disease can create joint momentum. Should there be a big flu outbreak or TB rears its head occasionally, I think that pulls us together. But otherwise the classes don't talk so much. Questions?
What do you see as the greatest financing challenges in Haiti for partners in health, but also for other most necessary things, perhaps in the social sphere that are contributing to health?
Yeah, it's a great question. Haiti needs some productive industry, so whether that's agriculture or something else, or even return to export economy, production and sweatshops, but on decent terms. Bill Clinton, who's now UN Special Envoy for Haiti, and pulled Paul into that office, and it's created this whole other venue for our work to work on the UN side. Clinton was largely working on manufacturing and setting up the necessary infrastructure and decent protections and rules around manufacture before the earthquake. And it's never an easy solution or the best, but that could be very important. So some local income generation seems crucial. Haiti's never been able to tax its wealthy, and there are a few, and that would be a decent turn forward. It's not going to happen under this administration because it's run by that cadre of rich people. I think that would be like the second big thing. And then I imagine would be the ability to hold on to its most talented and to allow education systems to grow and allow business to grow and not bleed out to Miami and Montreal and the other Haitian capitals in the world.
On that last one, I can't imagine why there wouldn't be partnerships with, say, U.S.-based hospitals and maybe other Latin American hospitals, where there'd be a deal that if you spend a certain amount of time in Haiti, we'll get you a great job in an upscale place, and have exchanges based on service like that. That could be done, where the resources and where their careers to give people opportunity, but whether it's conditional on study, or whether there's specialty high-quality units. I know India's built some fantastic medical tourism business in India to get certain treatments.
Yeah, but the neighborhood.
Yeah, but build something of that caliber around some illness or medical condition that's needed in Haiti, attract perhaps the best of all from North America that want to go there for that specialty, and then see what's going on around.
Yeah. There's only up. I mean, there's a lot of ways to be. No, but there's a lot of ways to be quite pessimistic about things, especially these last couple of years. But there's also, very real potential. Question?
Yeah, Dr. Lyon, I'd be curious to know what your professional background, what you've done over the years, and what brought you to Partners in Health. What motivated you to go that direction?
So for the students starting out, I went to college to be a musician. I didn't want anything to do with medicine and politics or science. But then quickly realized I was not going to make it, but also that I wanted to do service work. And so for me, that's kind of been the orientation, from some early exposure to Latin America and what that physical poverty was like. And then medicine stuff, I kind of did all my homework and did the prerequisite stuff that I'm sure you're all struggling through, and we'll get through. And I went to Haiti in 1996 to be a volunteer music teacher. Somebody invited me to live and work in Haiti, and so I took the chance to get out of the small town I grew up in, learn a language, be in a place I had no real intention of sticking around or going away. And just that's what I was doing. But through that experience, met Partners in Health, and then one thing's led to the other. I did try and get away from the work in 2009 and moved to Alabama, where I was doing HIV care and trying to work on these same sets of issues: rural medicine, community outreach, chronic disease kind of stuff in that context. But then the earthquake kind of got me pulled back in. One of the great joys, though, and I hope it's part of the spirit of the question, is I haven't had a very direct career path. I could tell you where I'll be in 5 years, I think, but not in 10. A large part of that has been the joy of just taking on work as it comes, saying yes as often as I can, working on new stuff that's a challenge, or, so learning history and getting to understand some of that, or grappling with globalization economics and some of the health consequences of these things. It's been really central to what Partners in Health has done as an academic group. Legal collaboration, prison work, stuff that I wouldn't do except it's been invited and I show up and say yes. I think it's very true, regardless of specialty and how lucky we are in our educations to go to these great institutions. Showing up is 99% of any job, and so that's what I keep doing. Yeah.
I just had a question about, you mentioned before that the previous dictator who was running the Haitian government is now back in the country, and there's a little bit of dissension there. Looking at the new hospital in Mirabel, is that how you pronounce it?
Mirabel.
And governmental issues and political issues, you mentioned how that might have an impact on economics as well, how the government's run. If it's a public hospital, you're looking at Partners in Health getting out of running the hospital eventually. Do you see issues with that, or is that something that the Haitian people are worried about right now as far as governmental change, policy change, things like that?
Yeah, no, it's a great question. Baby Jean-Claude Duvalier is not in power. He's been given too much freedom. He's not being challenged in the legal ways that are available. But he's not officially in power, although his son is part of this sitting government. The sitting government has allowed tremendous flexibility for him. And that